Hello everyone, I am Dr. Sahithi Balmuri, Consultant Obstetrician Gynaecologist and Laparoscopic Surgeon at KIMS Hospitals, Gachibowli. Today let's discuss about heavy menstrual bleeding. It's also known as menorrhagia in medical terms. Heavy menstrual bleeding is bleeding that lasts more than 7 days in duration or bleeding that is for 5 days but the flow is very heavy. So how do we know if the bleeding is very heavy? It is when you have to change your pads very frequently, that is within 2 hours or less, or you are passing clots larger than the size of a coin. Heavy menstrual bleeding can affect the quality of life and can lead to anemia, which can cause further health problems. So what are the causes of heavy menstrual bleeding? The most common causes are growth or tumor in the uterus like fibroids, or cancers of the uterus or cervix, or some kind of birth control techniques like copper-T, or in cases of early pregnancy loss like a miscarriage or abortion. Sometimes women with hormonal problems due to ovarian pathology can also have heavy menstrual bleeding. Some liver and kidney diseases can also lead to heavy menstrual bleeding. Even in thyroid dysfunctions, heavy menstrual bleeding is seen. In women who have bleeding disorders like platelet function disorders, or women who are on drugs like aspirin, that is blood thinners, also have heavy menstrual bleeding. So what are the signs? The signs of heavy menstrual bleeding is when the flow is very heavy. Like I already said, when you have to change your pad within 2 hours or less, or when you are passing clots larger than the size of coin, or when you have to double up your pads to control the menstrual flow, or when you have to wake up multiple times in the night to change your pads, or you feel easily tired, extreme fatigue and breathlessness during and immediately after your periods. So how do we diagnose the cause? Your gynecologist would advise some basic investigations like a blood test, which involves checking for your hemoglobin levels, your thyroid function test and your bleeding factors. A pap smear may be required to know the cervical pathology, and also an ultrasound may be required. In some cases, an endometrial biopsy may also be required. The main treatment aims at stopping the bleeding and improving your blood levels by the use of some iron supplements. It is important to diagnose the cause of this heavy menstrual bleeding and take appropriate action. It can be medical or surgical also sometimes. Thank you.